Now the people in Barua Goza, Kayalda, and 165 other villages have access to pipe-borne water. Another strategic health program addressing the health services delivery needs of the lowest poor communities and fast-tracking the attainment of the MDG goals 4, 5, and 6 in the Federal Capital Territory is now fully operational. The MDG's office of the FCT is deploying mobile integrated primary health care services delivery teams tagged Melafia, the bringers of good health, to address the wide disparities in health and health services between dwellers of the urban centers and the rural poor.
Nigeria has one of the worst health indices in the world. What we are trying to achieve or reach is to make sure we reduce the maternal mortality rate, the infant mortality rate, reduce the burden of tuberculosis and HIV. We are starting a pilot study and we are achieving results. Vis-a-vis procurement of project vehicles, recruitment of volunteers, doctors, nurses and midwives, lab scientists, community health officers to actually man this project for us.
Goals 4, 5, and 6 of the MDG really wouldn't have been met by FCT without the Melafia strategy as an intervention. First, there were primary health centers, 184 of them in the FCT, instead of the required 434, meaning only 42% of PHCs were achieved. And out of this 42%, only 17% of even the 42% are working. So it necessarily means that majority of these communities do not have access to health services, health delivery care services. And this has implications for goals 4, 5, and 6 of the MDG, which relates to maternal health, child under 5 health, and communicable diseases, HIV control.
Since May 2009, the Melafia teams have recorded more success compared to the primary healthcare centers in the communities. The Melafia program is delivering comprehensive maternal and child health care, including family planning, immunization against major infectious diseases, prevention and control of locally endemic diseases, appropriate and accessible treatment of common diseases and injuries, oral, mental health and care of the elderly, and provision of essential drugs to all. These activities are carried out 3 to 4 times a week to about 336 deprived rural populations who need them most on a monthly basis. In addition, the Melafia program provides public education and participation regarding prevention and control of health problems, promotion of food supply, and proper nutrition and an adequate supply of safe water and basic sanitation in these communities free of charge.
We have teams now that go around, mainly the most inaccessible, the relatively inaccessible areas of the LCT that do not even have the primary health centers at all. Within a very short time, we have been able to handle about 7,000 people, which otherwise would have remained untreated. And you can definitely see the happiness in their faces when these doctors and nurses go around.